There is a specific kind of frustration that only makes sense once you have lived with it. You lie down at night, exhausted, ready to finally rest, and the moment your head hits the pillow, one side of your nose closes up like a door swinging shut. You roll over, and a few minutes later, the other side does the exact same thing. Or maybe your stuffiness has nothing to do with lying down at all. It is simply always there. Morning, afternoon, evening, you blow your nose and nothing comes out, and yet you still cannot get a full, satisfying breath through it. You have started breathing through your mouth so often that your throat is dry every single morning, and people around you have started to notice the snoring. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and turn on the notification bell so you never miss our latest health tips. We share trusted, easy-to-understand advice to help you stay healthy, active, and informed. This is not a cold. You know that already because a cold comes and goes. This has been going on for weeks, months, sometimes years, and it never fully clears. What makes it so frustrating is that your body is not just being difficult for no reason. It is not a random glitch. Somewhere inside your nasal passages, something specific is happening on a tissue level, something with a real mechanism and a real explanation. And once you understand it, the entire situation starts to make a lot more sense. Here is what makes this even more discouraging for so many people. You are already trying. You are using saline sprays. You have an air purifier running in the bedroom. You have tried sleeping propped up on extra pillows. You may have even bought one of those over-the-counter nasal sprays that promises instant relief. And for a day or two, it worked beautifully. And then somehow your nose got even worse than before you started using it. That detail alone should tell you something important, and we are going to come back to it. The truth is, the answer here is not about trying harder or buying more products. It is about understanding exactly what is happening inside your nose, because most people are fighting the wrong battle entirely. For a long time, I have found myself genuinely curious about a very specific contrast. Why is it that some people can breathe cleanly through their nose their entire lives, in any season, in any weather, without a second thought, while others battle a stuffy, half-blocked nose for years, even when they are not sick, even when allergy season is long over? It is not simply about who has allergies and who does not. The picture is more layered than that, and once you see the layers, the whole thing becomes far less mysterious. According to information from sources including the Cleveland Clinic, the American Academy of Otolaryngology, and the National Institutes of Health, the leading explanation has much less to do with germs than most people assume, and much more to do with a process happening quietly inside the soft tissue of your nose, a process your body actually performs on purpose every single day, whether you are stuffy or not. Today, I am going to walk you through the #1 reason your nose stays stuffy, and then I am going to give you a practical, ranked set of fixes from the ones that help a little, all the way up to the one change that tends to make the biggest difference of all. And I will tell you honestly, the detail behind the top reason genuinely surprised me the first time I came across it, because it means that for a lot of people, one of the very things they are using to fix their stuffy nose is actually one of the things quietly keeping it stuffy. Before we get into that, I would love to hear from you. Drop a comment and let me know where you are watching from and tell me what your stuffiness actually feels like. Is it one side more than the other? Is it worse at night? Does it come with sneezing? Or is it just pure blockage with nothing else? I read these and it genuinely helps me understand what real people are experiencing. Now, before we get to the #1 reason, we need a short, simple stop in basic nose biology. I promise this will not feel like a textbook. Think of it as the map that makes everything else click into place. Without it, the real answer will not make nearly as much sense. A quick map of what is actually happening in there. Picture the inside of your nose, not as a simple empty tunnel, but as a space lined with soft, spongy tissue called turbinates. These structures sit along the walls of your nasal passages, and they are covered in a mesh of tiny blood vessels, almost like the tissue found in other parts of the body that can fill with blood and swell on purpose. When more blood flows into that tissue, it swells and narrows the space air can pass through. When blood flows away, the tissue shrinks back down and air moves freely again. Here's the part almost nobody knows, and it changes how you think about a stuffy nose completely. Your nose is not supposed to stay evenly open on both sides all the time. In most adults, the body runs something called the nasal cycle. Roughly every 2 to 6 hours, your autonomic nervous system, the same background system that quietly manages your heartbeat and digestion without you thinking about it, shifts more blood into the turbinates on one side of your nose while pulling blood away from the other side. One nostril becomes the working side, moving most of the air, while the other rests, swollen and slower, before the pattern reverses again later. This is completely normal. It happens in the vast majority of people, and most of us never even notice it because our brain blends the sensation from both sides into one steady feeling of breathing fine. It is one of the reasons you might notice one nostril feels more blocked than the other when you are lying on your side, since gravity and position add another layer on top of this natural rhythm. So a small amount of shifting congestion is not a problem. It is your nose functioning exactly as designed, humidifying air, filtering it, and giving its own tissue a periodic rest. The real issue begins when that swelling stops behaving like a gentle rotating rhythm and instead becomes constant, on one side or on both, day after day. When the turbinates stay engorged well beyond their normal cycle, that is when you get the sensation of a nose that never really opens, the mouth breathing at night, the reduced sense of smell, the pressure that sits behind your cheekbones by the end of the day. And that brings us to the number one reason this happens for so many people. The number one reason your nose is always stuffy. The leading cause of ongoing nasal congestion, once a simple cold has been ruled out, is chronic inflammation of that same turbinate tissue, most commonly driven by rhinitis, whether allergic or non-allergic. In simple terms, your immune system, or in some cases your nervous system, is treating something in your environment, or sometimes nothing identifiable at all, as a threat, and it responds by keeping those blood vessels dilated and that tissue swollen far longer than the normal cycle ever intends. With allergic rhinitis, the trigger is usually something specific: dust mites, pet dander, pollen, mold. Your immune system releases histamine in response, and histamine is extremely good at one particular job: widening blood vessels and increasing fluid in tissue. Do that repeatedly, season after season, and the turbinates can start to stay puffier as a kind of new baseline, even between flare-ups. With non-allergic rhinitis, there is often no clear external trigger at all. Instead, the nerves and blood vessels inside the nose become overly reactive to ordinary things: temperature changes, strong smells, spicy food, stress, even just going from a cold room into a warm one. The result looks and feels almost identical to an allergy, minus the classic itching and sneezing. But here is the twist that genuinely caught my attention, and it is the detail I promised you earlier. For a significant number of people, the original trigger might have started as a cold or mild allergy that has since resolved, yet the stuffiness never really left. Why? Because of what many nasal sprays, the fast-acting over-the-counter kind, actually do inside the nose over time. Those sprays work by forcing the blood vessels in your turbinates to constrict quickly, which is genuinely effective for a day or two. But used beyond about 3 to 5 days, something called rebound congestion can set in, sometimes referred to by its clinical name, rhinitis medicamentosa. The nasal tissue, deprived of its normal blood flow while the spray is active, responds with inflammation once the medication wears off. The vessels swell back up, often more than before. So you reach for the spray again, it works again, briefly, and a cycle begins where your nose becomes dependent on the very product you are using to unblock it. This is not a flaw in willpower. It is a straightforward physiological response, and it explains a pattern so many people describe without realizing what is actually going on. I used to just need it once in a while, and now I can barely breathe without it. So, to put it plainly, the number one reason behind most long-term stuffiness is ongoing inflammation of the nasal turbinates, whether from allergic triggers, a hyperreactive nasal lining, or a rebound cycle from decongestant overuse, all of which keep those blood vessels swollen well past the point your nose was ever designed to stay congested. Now that we understand why this happens, let's get into the fixes ranked from genuinely helpful all the way up to the one change that tends to matter most. Fix number 7, steam and hydration. This one is simple, and a lot of people underestimate it because it feels almost too basic to work. Warm, moist air helps thin the mucus sitting in your nasal passages and temporarily soothe swollen tissue. A hot shower with the bathroom door closed or leaning over a bowl of steaming water with a towel draped over your head can offer real, if short-lived, relief. Alongside that, staying properly hydrated throughout the day matters more than people expect. When your body is even mildly dehydrated, mucus in your nasal passages becomes thicker and stickier, which makes it harder to clear and easier for congestion to feel worse than it needs to. Water, herbal tea, and warm broths all count. Think of this as a gentle daily habit rather than a cure. It will not fix the underlying inflammation, but it keeps things from feeling worse while you work on the deeper causes. Fix number 6, elevate while you sleep. If your congestion feels dramatically worse the moment you lie down, this one is for you. Lying flat allows more blood to pool in the blood vessels of your head and neck, including inside your nasal turbinates, which is part of why so many people feel perfectly fine during the day and completely block the second they get into bed. Raising the head of your bed or using an extra pillow to keep your upper body slightly elevated reduces that pooling effect. Try to elevate your whole upper body rather than just bending your neck forward, since a sharply bent neck can sometimes restrict airflow in its own way. This is one of those small adjustments that costs nothing and often produces a noticeably better night of sleep within just a few nights of consistent use. Fix number 5, take control of your environment. Since so much chronic congestion traces back to allergic or irritant triggers, controlling what your nose is exposed to on a daily basis can make a meaningful difference over time. A few practical steps go a long way here. Wash your bedding in hot water weekly to reduce dust mites, since bedding is one of the most common places they accumulate. Consider a HEPA air purifier for your bedroom, particularly if pet dander or seasonal pollen tends to trigger you. Keep humidity in your home in a moderate range, since air that is too dry can irritate the nasal lining, while air that is too damp encourages mold, another common trigger. If you have pets, keeping them out of the bedroom, even if you love having them close, can noticeably reduce nighttime congestion for people who are sensitive to dander. None of this needs to happen all at once. Pick 1 or 2 changes and build from there. Fix number 4, start tracking your pattern. This step does not sound like a fix in the traditional sense, but it is one of the most useful things you can do because it helps you figure out whether you are dealing with an identifiable trigger or something more constant. For about 2 weeks, jot down a quick note whenever your congestion spikes. What were you doing? Were you near a pet? Had you just eaten something specific? Was it after mowing the lawn, cleaning, or being in a certain room of the house? Did it happen at a consistent time of day, regardless of location? Patterns tend to reveal themselves surprisingly quickly once you are actually looking for them. If your stuffiness has no clear pattern and shows up regardless of season, location, or activity, that is useful information too, since it points more toward a non-allergic or rebound cause rather than a classic allergy. Fix number 3, saline nasal irrigation. This is where things start to move from helpful to genuinely effective. Rinsing your nasal passages with a saline solution, whether through a neti pot, a squeeze bottle, or a pre-made saline rinse kit, physically flushes out allergens, irritants, and thickened mucus sitting in your nasal passages. It also helps keep the delicate lining of your nose properly moisturized, which supports its natural ability to calm down and function properly. Unlike medicated sprays, saline rinses do not cause any rebound effect, no matter how often you use them, because there is no active drug involved, just gently balanced salt water. This makes it one of the few nasal remedies that can genuinely be used daily, long-term, without creating a new problem down the line. If you have never used one before, use distilled or previously boiled and cooled water, never straight tap water, and follow the instructions on your specific device carefully. It can feel strange the first time, but most people get used to it within a few tries, and many describe it as the single habit that made the biggest day-to-day difference in how clear their breathing felt. Fix number 2. Retrain your breathing and try the quick manual trick. There is a fast, no-equipment trick a lot of people swear by when they need momentary relief, and it works with the same blood flow mechanism we talked about earlier. Press your tongue firmly against the roof of your mouth, then press one finger gently between your eyebrows, right above the bridge of your nose, and hold both for about 20 to 30 seconds. Many people notice a temporary loosening sensation as they release. It will not solve chronic inflammation on its own, but as a quick, in-the-moment relief technique before a meeting or before bed, it is worth having in your back pocket. Beyond that quick trick, Practicing slow, deep nasal breathing throughout the day, rather than defaulting to mouth breathing the moment your nose feels even slightly blocked, actually helps retrain your nasal passages over time. Consistently forcing air through even a partially blocked nostril encourages that side to decongest faster, while constant mouth breathing allows the nasal tissue to sit swollen without ever being challenged to open back up. Fix number 1. Break the rebound cycle. And now we arrive at the change that tends to matter most, especially for anyone who has been reaching for a fast-acting decongestant spray more than occasionally. If you recognize yourself in this, using a decongestant spray daily, or feeling like your nose barely functions without it, the single most important fix is breaking that rebound cycle. This usually means slowly stepping away from the medicated spray, often one nostril at a time, while leaning heavily on saline rinses to manage the temporary increase in congestion that shows up during the transition. For many people, this rebound period is uncomfortable for a week or two, which is exactly why so many give up and go back to the spray. Understanding that this discomfort is temporary and that it is a sign the nasal tissue is recovering rather than getting worse makes it much easier to push through. If your congestion is significant, persistent, or tied to allergies that are hard to manage on your own, this is also the point where talking to a doctor becomes genuinely worthwhile. Prescription-strength nasal steroid sprays work completely differently from the fast-acting decongestant type. Rather than forcing blood vessels to constrict, they work gradually to reduce the underlying inflammation itself, and they do not carry the same rebound risk. A doctor can also check for structural causes, such as a deviated septum or enlarged turbinates that home remedies alone cannot fix. Breaking the rebound cycle is not glamorous, and it is not instant, but it is very often the single change that finally allows the other fixes on this list to actually work the way they are supposed to. 3 mistakes that quietly undo your progress. Before we wrap up, let's talk about 3 mistakes that can undo even the best efforts on this list. The first mistake is using a fast-acting decongestant spray for more than 3 to 5 days without a break. It feels harmless because relief is instant, but this is exactly the pattern that creates the rebound cycle we just talked about. If you find yourself using one regularly, that is the clearest signal that it is time to make a change. The second mistake is ignoring congestion that is dramatically worse on one side than the other, especially if it does not shift or improve at all over time. While some one-sided variation is completely normal thanks to the nasal cycle, congestion that is constantly and significantly worse on one specific side, especially alongside nosebleeds, facial pain, or a reduced sense of smell, deserves a proper medical evaluation rather than another home remedy. The third mistake is expecting an overnight transformation. Chronic nasal inflammation typically built up gradually, and the tissue needs time to calm back down, especially if a rebound cycle is involved. Most people notice real, lasting improvement somewhere between 2 and 4 weeks of consistent habits, not 2 or 4 days. Give the process the time it actually needs. And one final important note, if your congestion is severe, is getting steadily worse, comes with facial pain, fever, or a reduced sense of smell that does not return, or is affecting one side far more than the other with no clear explanation, please see a doctor. These fixes are excellent tools for supporting everyday nasal health, but they are not a substitute for proper medical evaluation when something more serious might be going on. If this video helped you finally understand what has been happening inside your own nose, consider giving it a thumbs up. It genuinely helps this information reach other people who are dealing with the exact same frustration, often without knowing why. And I would love to know, which of these fixes are you going to try first? Take care of that breath. It is easy to take for granted until it is not there. And with a little understanding of what is really going on, clearer breathing is very often closer than it feels.